So you have a role. David Moucher has a role from
Yep.
Windsor Regional, and Terry Shields from
Yep.
Leamington District Memorial Hospital. They have a role also?
Yep, as well. I think it's important that the new acute care hospital doesn't mean that other services stop happening in the community.
Right.
And so I think that David said that in an information session. He was asked directly about the role of Leamington Hospital. But all of us will go through some changes because we're building a health system. And a health system means that each of us has a unique role to play.
Right.
And that role is complementary to the other roles. And what we don't want is each of us doing the same thing,
Sure.
because that's not efficient, it's not effective.
That's what it is.
So we don't want to duplicate each other's
Sure.
roles, but we also want to make sure that we're integrated so that patients will have a seamless journey through the healthcare system. Because the worst thing that can happen is that a patient has to say the same thing, get different services, get the same services. It's fractured and fragmented,
Sure.
and we're trying to get past all that.
Good. Now, one of the things, too, is, as you know from watching the show, we're really big on hospice.
Yep.
And hospice has been part of our life here on Face to Face. And I was unaware of your palliative services.
Yep.
So tell us a little bit about your role in palliative care.
Well, we are very proud to operate 20 palliative care beds in our complex care, which is that building at the end, complex continuing care. There's a whole wing, 20 beds. It's an amazing place. I toured it. I spent a couple hours doing some rounds there a couple of weeks ago and talked to a lot of the patients and the staff. They're very proud of the work they do there,
Sure.
as they should be. It's a beautiful space. It's been outfitted by Transition to Betterness, so we have a great partnership there. I think the role of palliative care in the community is changing as well, and so we have a strong relationship with hospice. They're doing some work with us. We're doing some work with them. There is a need to really define what does palliative care look like in our community, because again, we are an aging community, unfortunately, and palliative care is going to become a much bigger conversation for us in the next probably 30 years.
All right. So we're going to take our first break, our only break. I'll even give you one break today.
Okay.
Learn a little bit more about palliative care. When we come back, we're going to talk about what they're doing downtown and the mental health and things that you didn't know what's going on in the city that are brought to you by Hôtel-Dieu Grace Healthcare. So a little bit on palliative care.
The feedback I've heard from folks is around how they feel here, how well they're received, how their family members feel when they're here. You know, for some folks it's weeks, for some folks it's days, for others it could be months. In some cases it's end of life, and in all those instances they're very pleased with how they're made to feel here.
Every patient is different. Every single one is an individual. Everyone has something that works for them, it doesn't work for someone else.
It all comes back to making people happy. For some of the patients, the nurses are the only comfort that they get. Sometimes they don't have family or anyone, so that's all that they have is us.
We want to give them their dignity, whether it's going home, going to rehab, going to a nursing home, or if it's just the passageway to death. We just want to give them the best.
That's what nursing's about.